Well, all new tonight from the I-Team, a $25,000 grant coming under the microscope sent from Albany straight to People Inc. This money is being used to purchase anti-choking devices to be used within their facilities. But these devices are not recommended for use by some key federal agencies. So where's this disconnect? Tonight, our 7 News I-Team investigator Ed Dranch is sharing the voices of a choking victim, the People Inc. CEO, a state lawmaker, and the founder of LifeVac, letting you decide if this was the best use of your taxpayer dollars.
It's right here.
It's hanging in your pantry.
Yeah.
Christine Opera has this clear plastic bag ready to go inside her Lancaster home in case of an emergency. What is this?
I don't know. Should we open it and look? Because I haven't yet.
She laughs now, showing me what's in the bag.
So I guess there is a little plunger thing here.
Along with some masks, a tool to literally suck something out of your throat if you're choking. It was something she bought after, no laughing matter, choking on a piece of steak at a wedding. It was a good idea to make this buy, Opera thought, even though a nearby nurse gave her the Heimlich at the time. What's the benefit of having these vacuums?
I think I just feel better knowing that there is something in the house. Under pressure, I'm not sure if I would be able to get it out of the package.
To Opera's point, the FDA explains in a 2024 memo, anti-choking devices first could delay action, as consumers usually have to take them out of packaging, assemble them, and follow device instructions, which may delay the use of established rescue protocols. The Food and Drug Administration does not endorse and has not cleared these products.
I did not know that wasn't approved, FDA approved.
Well, what do you make of that statement?
I mean, it's pretty scary.
Beyond that, the State Office of Children and Family Services issued a letter earlier this year explaining established rescue protocols do not include anti-choking devices, including a device called LifeVac, which People Inc. is now using thanks to a $25,000 grant from New York State. Ann McCaffrey is the president and CEO.
Knowing the propensity of choking for people that we serve, we thought it would be an additional asset for us to implement.
Is this the best way to spend that money?
We think so. I mean, this is going to impact thousands of lives potentially.
That $25,000 grant bought about 200 of these LifeVac devices placed in each of People Inc.'s residential homes and day programs.
Push and then pull.
Marilyn Militello is the chief program officer at People Inc.
I'm an old nurse.
So you're very keen on following guidelines. You're very keen on following rules and regulations.
Correct. Yep.
The FDA has not endorsed these products, and the FDA has in fact said that the Heimlich maneuver is what should be used first and foremost. How, as a nurse with a nursing background, do you respond to that, knowing that these are now part of your toolbox?
Sure. And we had a lot of discussion around that, understanding that this has not gone through the FDA approval at this time.
Whether it is endorsed by those organizations, I don't know if that really matters.
That's Assemblymember Karen McMahon, who sponsored the grant. She represents Williamsville. $25,000 for a device that is not endorsed by the FDA, for instance. Is this the best use of taxpayer dollars?
I don't think it's a bad use of money to provide equipment that could potentially save someone's life. If this was some crackpot device, the assembly would probably have stepped in and said, "Oh, I'm sorry, no, this is not something we're going to endorse or fund."
That grant is funding Arthur Lee. He's the founder and CEO of LifeVac, a company that claims to have saved more than 4,000 lives at homes, schools, and workplaces.
We're one of the companies working with the FDA to kind of reclassify these suction devices.
An FDA spokesperson would not confirm Lee's statement, explaining the FDA generally cannot confirm or deny the existence of a pending product application that has not been previously disclosed by the sponsor or discuss the status of a pending application. Yet Lee says it's just another option for People Inc., serving the intellectual and developmental disabilities community, which, if the Heimlich maneuver didn't work, he says, would be in trouble.
I don't know how we could say providing an option for people that may have no option, particularly those with challenges, is a bad idea. I don't know how we would argue that we should just let them die.
Yep, plunger.
Back in Christine Opera's kitchen, do you have faith in these devices?
No, I don't. Knowing that they're not approved, I probably wouldn't use it now.
The American Red Cross does not endorse LifeVac nor any other anti-choking devices. In a statement, the Red Cross says it recognizes the need for further high-quality, independent, randomized studies of such devices, as well as FDA approval. It does point out, however, based on the findings from a review by the American Red Cross Scientific Advisory Council, if back blows and abdominal thrusts aren't working or aren't feasible, anti-choking devices are an option to consider. For the 7 News I team, I'm Ed Dranch.